we're not ever going to get rid of cancer. We're not going to cure cancer and prevent it. Cancer is a disease of aging. We all have 20,000 genes. All it takes is one abnormality, one mutation in one gene, and that's what develops cancer. The older we get, the more things we're exposed to, and this is why cancer, with the exception of testis cancer and Hodgkin's and childhood leukemia, is a disease of older people. No one, when they're 90 years old and they die, they don't die of old age. They die of cancer primarily, less so heart disease, stroke, diabetes. So the idea of a war on cancer and that we're going to get rid of cancer is a genetic disease, not because you inherit from your parents, but because it takes one mutation in one gene to cause cancer. So I think we need to have truth and dialogue also when we're talking about the war on cancer. The final thing that I would say is Dr. Mukherjee's book is just outstanding. It reads like a piece of fiction, but it's a biography of cancer. But if he were to write it today, he would admit that he left out a very important chapter, and that's immunotherapy. And the idea has been around since Coley's toxin from 1900, that how can we stimulate the immune system to better fight cancer? Sir Macfarlane Burnet in England in the 1970s opined that the reason why people get cancer is that your immune system stops working, what we call immunosurveillance, and allows cancer to get a foothold. And we need to stimulate the immune system. And people have been trying to do that for decades, and the last 5 years they've been successful. What happens when someone has cancer is the body's immune system, what are called T lymphocytes, go to the cancer cell to try to attack it, just like we do when you have a viral infection or a bacterial infection. But we have these inhibitors. The cancer cells are very smart, and they block the access of these T lymphocytes from killing the cancer cells. So what we have now with immunotherapy is called immune checkpoint inhibitors. We're able to block the sequence, and we outsmart the cancer cells, and we get these T cells to destroy and restore the immunological balance that the patient had before they had cancer. So this is a whole new class of drugs. We've gone from surgery, radiation therapy, chemotherapy, molecular targeted agents like Gleevec or Herceptin in breast cancer, and now there's a new kid on the block, and this is the most exciting kid on the block in 2015, and that's the concept of restoring the immune balance with the immunoregulation with these new immune checkpoint inhibitors.